most doctors think that if you post a video about treatment, the right patient will find them and book an appointment. But then you're frustrated because your views are low, and even worse, you get zero views and zero business. The reason? You're talking to people who don't even know they have a problem yet, or you're trying to sell to people who are still researching symptoms. Today, Mike and I are going to show you the 5 stages of awareness, a legendary marketing framework and by Eugene Schwartz, and how you can use it to structure your YouTube content so viewers don't just watch, they become buyers. I'm Dr. Ann Trong, and we are serial entrepreneurs, and I have learned how to monetize 19 sources of income from leveraging my medical expertise online.
I'm Dr. Mike Lumeng. I'm also a serial physician entrepreneur, been able to buy and sell 7-figure businesses. So today we want to go over the 5 stages of awareness and how you can start changing those viewers into patients. Let's start with the first one, Ann.
All right. So there are 5 stages. So the first one is unaware. These are the people that have no idea they have a problem. They think their symptoms are just part of aging, or they haven't noticed them yet. So, like for instance, like for some people that have, like, maybe they're tired or they are falling, but they don't know that maybe due to thyroid, or maybe due to something going on with their balance, right? If you are targeting the people that are unaware, you want the strategy for the content is using pattern interrupt title, such as like, why you're exhausted after 8 hours of sleep. And then you say, well, you aren't selling a sleep study at this point yet. You're just pointing out the symptom they ignore. Another example will be, like I said, you're targeting people that are hypothyroid, and you say, why you feel exhausted after the whole day. Maybe it could be due to your thyroid. So for me, when working with men with ED, if I was going to do the unaware, I can say, well, maybe you're finding out that you're not functioning as well as you used to. Maybe it's due to not adequate sleep, something like that, right? So that is the broad. Think of it like a funnel. So the 5 stages is essentially like a funnel. A funnel is like this, wide open at the top, and it gets narrow, narrow. And the wide opening at the top is everyone. So you're trying to catch like a wide net. The more narrow you get down the funnel, it's the more that the viewer engages with your content, start to know, like, and trust you, and start to become a buyer and eventually a patient. Does that make sense? So think of it like this, like a funnel. The top, the stage one is unaware. So these are the people that have no idea, what problem they have. And then the second stage is problem aware, that now they know there's something wrong, but they don't know the name of it or how to fix it. They are searching for symptoms. And this is where, as physician, you excel. Because this is the part where we coach physician, we look at, this is your HPI. This is your symptoms. When you're doing an HPI, you're looking at positives and negatives. So this is your HPI. So when you're producing content, you're on YouTube, you're producing content that attract viewers, you want to talk about what is and why video. Like for an example, like you can say 3 signs your knee pain is actually due to a meniscus tear. So you are putting a name to the pain. And then let's say for a lady with menopause, you can say, you know that hot flashes and night sweat may be related to the beginning of menopause. Those are the things that you're relating symptoms that may be related to a condition. Does that make sense? So I correlate this with HPI. The next is solution aware. All right, so you're going down the funnel now. So follow me. So I'm correlating this with the subnote. Solution aware is almost like objective finding, like your examination. So these are the people that know that they have a problem. Let's say they have a meniscus tear, and they know that solution exists, such as like surgery, physical therapy, cortisone injection, but they haven't chosen your specific solution yet. Let's say you a regenerative medicine doctor that does bone marrow or fat or PRP for knee, but they don't know about your solution yet. So this is the most important part. So this is where you talk about your solution. So when you produce content, you want to do a comparison video. You want to do something that starts with like the truth about blank. For example, surgery versus conservative care. Is this right for your knee? So you're kind of leading them to your particular solution. For me, for treating men with erectile dysfunction, I would say ED medication versus implant, or like ED medication versus diet and exercise. Which one is right for you? Think of it like this: it's comparison and the truth about. So this is kind of like the objective finding of the video. And then the fourth one is product aware. This is the provider stage. This is when they know about you and your specific method, like your non surgical approach to knee, or that my natural solution for ED, but they aren't sure if you are the right fit for them. So it's like they know what you do, but they're not sure whether they can trust you or you are qualified for them. This is when you produce content, you want to put down case studies, testimonials, and do videos that is like how we do it video. So an example is you can do how we help a 60-year-old golfer get back on the greens in 4 weeks without surgery. If you're doing regenerative medicine, such as PRP for the knee. And for instance, for me, it's like how I help a 60-year-old man with ED get back to functioning within 5 days without medication or surgery. So think of like how we do it, because they talk about your credibility. And then the number five stage is called the most aware. This is when they are ready to buy. They just need to know where the buy button is or the reason to act now. This is where they're at the bottom of the funnel here. They know who you are. They know what you do. They know about your process. They just need to decide, well, okay, they're going to take out that credit card or not. So in your content strategy, you want to do direct offer and do FAQ videos. For an example, like how to book your discovery call, what to expect in your first consultation. I do this every day in my content strategy on our channel as well. And why am I talking about it? Why am I talking about the 5 stages and how is it applicable for you? Because what we see is that most doctors just stay in problem aware, right? They are not taking the viewers into the funnel, into working with you directly and seeing you as the expert. This is what's called the content strategy that I love to teach doctors about. So, if you're a doctor trying to build an online presence, you need to really audit your last 10 videos. Which stage are you really talking to? And if they were all in the most aware stage, that's why your views are flat. So, what we want you to do is to look at these 5 stages and decide what videos you are. And I would suggest if you're starting out a new channel, stay around 70% at most aware, and then do the 30% in problem aware stage, which is stage number two, and then solution aware. And then as you do more, like I say, you produce over 20 videos, then 40% from solution aware to product aware to most aware. And then the 60% in problem aware. You want to avoid the unaware, because the unaware, you have to kind of teach them that this is the problem. And it's hard for people to understand that. You want to kind of stay in the problem aware, right? Because these are the people that know they have a problem, but they don't know what it is or what's relating to. So that's where you excel. That's your HPI as well, too. So your content strategy should be 60-40. And that if you start doing this, you will start noticing your views go up. And then if you must have a funnel on your YouTube channel or even on your Instagram. You need to have a funnel or link that they can click to, so that way they know how to book an appointment with you or know how to work with you as a coach. Most doctors don't put a call to action on their channel, but how are you going to make money? Right? What we see a lot is that doctors get burnout when they're producing content because they're not getting good views, they're not getting people to reach out to work with them because they're not completing the step. This is probably the most important and valuable episode from our channel. And I want you to listen to this over and over again because it literally took me 2 years to really understand this and to how to apply it to my content creation strategies and how to really strategize my content to take a person from a viewer into a buyer, as in like in my coaching program or my course, and eventually a patient in my office for high ticket, which is 15,000 and up. But you can bring somebody online to directly into the funnel, and sometimes it will take somebody months to years to go through your funnel, to go to the 5 stages of awareness with you, or it may take somebody a week. Because if you're talking to somebody that has a very pressure problem, let's say for me, I know that my avatar is 50-year-old male that recently got divorced and think about dating again and want to make sure that everything is working okay. He's probably level 4 right now, which is maybe product aware, and then he's ready for level 5 right away. So sometimes be patient. And I have patients that started to see me now after 3-4 years following my content online, and they're finally made the decision to see us in the office. But the whole time they'll be buying a supplement from us and courses from us as well too. So you never know where your viewers are and what levels of awareness they are. So that's why I encourage you to produce content at level 2 at 60%, and then level 3, level 4, level 5 around 40%. So you catch different type of viewers. So Mike, what do you think about the 5 levels of awareness there and correlating that to a soap note?
Yeah, I love it too. And I think that's where most doctors go wrong is that, and I'm guilty of this myself. 100% of my content is for like product aware, most aware. I just want to put a little button on there to say book an appointment on there. But that's not right. Most of our audience is in that 60 to 80% in that unaware stage or problem unaware. So if you want to grow your channel and your practice, it's three things. A, you want to attract them with unawareness, with the unaware, the problem aware content. Those are going to give you your high views. Then you want to educate them with the solution aware content. What that does is it builds authority. And then that's when you talk using your product, most aware content, you converting with them. That's going to generate revenue. Stop asking people to just a book now button in a video on like what is weight loss. It's a mismatch of awareness. So I would recommend that if you're a doctor and you're trying to build an online presence, you need to audit the last 5 or 10 videos are that you're at. Which state were you actually talking to? If we're all for that most awareness category, that's why your views are flat.
That's right. So what we're here for is that to help you with the roadmap, because it took me 6 years now to figure this out and finally know what I'm doing, my content strategy. So check out our channel, Doctors Online Success, where we share courses for you. It's free to join, and it's a community of doctors in there helping one another out. Because in the end, Mike and I want you to know that you can leverage your medical expertise online and create multiple sources of income, but also that we want you to win getting outside of the medical system right now, because it is an underserved area and people really do need your help, and that you can create content to help somebody now, because you know that you can help millions of people and you don't even know who they are yet. But I can tell you from my own YouTube channel, we have about 10 million views a month. And I would see comment and say, "Oh, I follow what you recommended, and now I am so much healthier, and I appreciate you." And I don't even know who they are. I don't know where they live, but it should make you feel good that you're helping people with just free content online. And so you want to make an impact. And if you want to find more freedom in your time and in your finance, you have everything you need right here. So go to join at doctorsonlinesuccess.com or the link down below right here. And just know that you are not just a doctor, you are a doctor boss.